Hello student, in this video we will talk about thyroid hormone and thyroid inhibitors. So as we know that thyroid hormone is secreted from thyroid gland, and thyroid gland secretes three hormones. First is T4, also known as thyroxine, and second is T3, triiodothyronine. These two hormones are secreted from the follicular cells of thyroid gland, and another hormone is calcitonin, which is secreted by interfollicular C cells of thyroid gland. So next we will discuss about the synthesis and storage of these T4 and T3 hormone. So as this is a thyroid follicular cell, first what happen is there are 5 steps in the formation and in the synthesis and storage and release of the thyroid hormone. So first is iodide trapping, second is oxidation and iodination, third is coupling, fourth one is storage and release, and fifth is peripheral conversion of T4 and T3. So what is iodide trapping? As first it is the first step in the synthesis of thyroid hormone T3 and T4. So as you can see in this diagram, first the iodide ion from the plasma is taken into the thyroid follicular cells with the help of a sodium iodide symporter. It is an active transport. So this iodide is taken into the follicular cell. This step is known as iodide trapping. Then this iodide ion is taken to the intercellular membrane of this follicular cell, where there will be oxidation and iodination of the iodide ion will occur. So what will happen? There will be formation of I plus ion, then HOI ion and EOI ion. So what is I plus, HOI and EOI? These are the different formation of this iodide ion. So next what happen is then thyroglobulin will bind to these iodide ion, and there will be formation of monoiodotyrosine thyroglobulin and diiodothyroglobulin. So these MIT and DIT then will be converted into the T3 and T4. This third step is coupling reaction. Coupling means when there will be joining of two DIT ion, then there will be formation of T4, that is thyroxine, and one DIT molecule will combine with one MIT monoiodotyrosine thyroglobulin molecule, then there will be formation of T3. So here T3 and T4 will formed and they are attached to the thyroglobulin. These are taken into the follicular cell with the help of endocytosis process. Next, they are stored in the vesicles where will occur proteolysis, and from proteolysis there will be T3 and T4 will be released, and MIT and DIT will be separated and again they will combine with this iodide ion. Next, when T3 and T4 is released into the follicular cell, they also get released into the plasma. They will diffusion with the help of diffusion process, they will go to the plasma, and at peripheral site the T4 will be converted into T3. T4 thyroxine hormone is formed in higher concentration than the T3 hormone, and T3 hormone is more active form than T4. So what are the differences between the T3 and T4 hormone? T3 hormone has shorter duration of action, that is 1 day, and T4 has longer duration of action, that is up to 7 days. T4 is less active, T3 is more active. So T4 and higher amount of T4 is stored and released, whereas T3 amount is released in less concentration. So they are peripherally converged. The T4 will be peripherally in peripheral tissues. T4 will be converted into T3, that is an active hormone. So how the secretion is regulated, how the thyroid hormone secretion is regulated? As we discussed in the anterior pituitary hormone, that there is from anterior pituitary thyroid stimulating hormone is released. So what happen is, first from hypothalamus thyroid releasing hormone will be released, which will act upon anterior pituitary. From anterior pituitary thyroid stimulating hormone will be released, and it will act on the thyroid gland follicular cell, which cause the synthesis and release of T4 and T3. And these T4 and T3 has negative feedback on hypothalamus as well as an anterior pituitary. So when there is more amount of T3 and T4 are formed, they will cause the negative feedback. So there will be no release of TRH, then there will be no release of TSH, and T3 and T4 concentration will be lower in our body by the help of negative feedback mechanism. So what are the action performed by these thyroid hormones? If we talk about action of thyroid hormone, first is growth and development. So first action is growth and development. T3 and T4 are essential for the normal growth and development. For example, their deficiency causes in children, when if there is deficiency of thyroid hormone, it will cause cretinism, and in adult they called mixed edema. As such, if there is hypersecretion of this thyroid hormone, they will cause to thyroid toxicosis. Next, their effect on metabolism of lipid, carbohydrate and protein. Effect on lipid, they enhance the lipolysis, means they increase the breakdown of lipids, and they increase the level of free fatty acid in plasma. Next, action on carbohydrate is they increase the utilization of sugar. They causes glycogenolysis, means they break down the stored glycogen, and they also causes gluconeogenesis. Next, on the action of protein, they have catabolic in nature, so they break the protein to generate the energy. They have negative nitrogen balance, and they also causes tissue wasting. Next is calorigenesis. Calorie means there is thermogenesis, so they will increase the basal metabolic rate, and they also increases body temperature. Next, on the effect of CNS, thyroid hormone is also responsible or necessary for the normal functioning of CNS, skeletal muscle and GIT. Next action is on blood cells, that is hemopoiesis. T4 facilitate the erythropoiesis, that is formation of RBCs. Now, how the thyroid hormone function, means what is its mechanism of action? T3 and T4 will enter into the cell, and T4 is converted to T3. Then T3 combines with the nuclear receptor, and they cause the activation of different genes. These activation will cause the synthesis of various protein, and they will exert their action by this mechanism. Next is, what are the preparation of thyroid hormones? Preparation available for thyroid hormone for T4 is levothyroxine, thyroxine sodium, L-thyroxine, and it is given orally as well as parenterally by IV route. And T3 preparation is liothyronine, and it is administered IV intravenously. Where these preparations are used? These preparations are used in replacement therapy in hypothyroid state. For example, in case of cretinism and myxedema. For cretinism, the treatment of newborn is started as early as possible after birth to ensure the normal growth and cognitive development. And in young adults with hypothyroidism, that is myxedema, full replacement doses of levothyroxine sodium can be administered. The goal of therapy is to relieve symptom and restore serum TSH to normal levels. Next is mixed edema coma. Mixed edema coma is a medical emergency, and it occurs in those cases where mixed edema is not treated and remains untreated for a longer period. So this mixed edema coma is precipitated by infection and stress. So the clinical feature of mixed edema coma are like hypothermia, bradycardia, pleural effusion, pericardial effusion and coma. To treat mixed edema coma, the treatment is first levothyroxine, that is T4 is given intravenously, then intravenous hydrocortisone is given, and for hypothermia correction, patient warming is done, then electrolyte correction is done, ventilatory support if required then be given, and antibiotic if the infection is the precipitating cause of mixed edema coma. Next use of these thyroid preparations are in treatment of benign thyroid nodule to suppress the TSH levels. And fourth is thyroid carcinoma. Thyroid hormone suppression therapy is used in papillary carcinoma of thyroid to suppress the TSH, and it prevents the stimulation of growth of tumor. If you like this video, please like, share and subscribe, and in next video we will talk about thyroid inhibitors. Thank you.